About every 40 seconds, someone in America has a heart attack or stroke. Stroke ranks number 5 amongst death, and stroke is a leading cause of serious long-term disability.
We're laughing, we're celebrating, but this is not a joking matter.
And I wanted to welcome you all to our 3rd annual Heart Attack and Stroke Free Zone Annual Summit.
Used to seeing them participate. They had high blood pressure, hypertension, they had diabetes, and so I thank God that Be There San Diego and the REACH program, it has never been about money. It has always been about passion. And even within our own church, we stopped selling fried chicken and bacon, and we have healthy foods.
When you've seen someone young, the breadwinner of a family, have a stroke, it doesn't only affect them, it affects the whole family. So one of the things we had to do was get the word out to the community. If you do have a stroke, you need to come to the hospital early. And I can tell you, TPA, it can be magical if it's administered in the right time frame. There's evidence of mistrust and miscommunication, and that it's widespread. This is not an isolated problem. But when I'm called to a room when a family is livid, mad, the first thing they tell me is, he didn't care, she didn't care, she wasn't compassionate. So first we have to deal with ourselves and look ourselves in the mirror, and then we also, as leaders, have to deal with the people in our practices.
doihaveprediabetes.org website is extremely popular. And again, we've got a lot of good information for people who are at risk, where they can go there themselves, or you can use this as a clinical resource.
We have embarked on sort of embracing a group of best practices surrounding the following issues: undiagnosed hypertension and self-monitored blood pressure, team-based care, the growing challenge of prediabetes.
At Sharp-Ridge Daily, we have 47,000 patients diagnosed with hypertension. The philosophy, as all of us have, is that we are trying to really make sure that patients take ownership of their health. And basically, every patient who's enrolled in the program receives daily messages around exercise, diet, medications.
We have about 65,000 patients, 275,000 visits. 99% of our patients are below 200% of the federal poverty level. That is our greatest disparity right there. And even on top of that, we still have 9 to 15% of our patients that have no insurance.
I was asked to talk about kind of our team-based approach. What we've done is, number one, is make sure our staff are taking blood pressures accurately and in the way that they're supposed to be done when patients check in for any type of visit.
For us, most of this stuff gets done before the doc even goes in the room. So our medical assistants are trained. If there's anything that's red on there, they are to have a discussion with the patients.
To give you a little bit of an idea, a lot of you people will struggle with where and when you can probably implement a pharmacist in part of the care team, because pharmacists are seen as expensive, right? Labor is expensive, okay? But they're a lot cheaper than physicians.
How many of you have been personally impacted by cardiovascular disease? It wouldn't be 50%. It wouldn't be 80%, it'd be 100% of you have been impacted by cardiovascular disease. In 1994, I had my father-in-law and my father both die of a massive heart attack.
People want to be there and live longer. And they want to see their grandchildren and great-grandchildren and great-great-grandchildren. And we know that if we address this, we can turn things around.
We can't do that. Only you can do that. Only the community, if it's set on really eliminating heart attacks and strokes, can do what's necessary to reduce risk factors, which in fact can at least dramatically reduce, if not eliminate, heart attacks.